In my country, Ghana, evidence-based practice is not very popular. So far, we've not been able to translate evidence-based practice into our healthcare.
Everybody talks about it in medical school, in universities. You hear about it everywhere: evidence-based practice, evidence-based medicine, many things. But nobody takes time to see if what we are doing is up to date, or we need to learn new ways of doing things that are based on evidence.
I think when you go to the public sector and see how people are suffering, then you want to prevent illness rather than wait for them to come for treatment because they can't afford it anyway. So yeah.
Yes, we've read about a lot of evidence-based practice, and we see it being implemented in the research institutions and in the universities. But as far as sector is concerned, that's the Ghana Health Service, we realize that most of the time they work using government policies and other things, most of which are not evidence-based.
In my setting, the situation is, I would say, desperate, because as a medical doctor, I would be many times the only doctor available. And that means you have to work all the time, day and night, all the time. And when you go to attend to people, especially mothers, pregnant women, you see the desperation in their faces. And you really see the contribution that you make, even as an individual. I could feel it, so much so that it was never possible for me to say, I am tired.
Ever since I came here, I have learned a lot, and I have come to realize that it's not about having evidence each paper and you put it there, but rather you using this evidence into practice and see whether there is improvement, such that what people do, especially in the healthcare setting, is based on this evidence, but not rather to collect evidence, research, and keep in the shelves. So I've learned a lot, and actually this hand hygiene project to me is the beginning.
So for the babies and the mothers, that means better information, which is based on some evidence, and therefore better care for the babies, and then survival. I mean, because we really want to reduce morbidities, we want to reduce sickness, we want to reduce death. So having the correct information means people will have the right practice, and therefore they will reduce sickness and reduce on death, which already we say is still a problem in many of our countries. Yeah.
The question is whether the knowledge is current and whether the knowledge results into practice. Yeah. So that's the gap, because even in my project, what I found is most Kenyan doctors know about pediatric tuberculosis, but what they do with the knowledge is what, quote unquote, needs to be, worked on, so that they're influenced to practice what they know, and also probably to have access to evidence-based or evidence-informed, solutions to health, rather than what has been known over the years.
Yes.
It has to be current, and probably what I realize is if you do it well the first time, it's even cheaper for the patient and for the institution. But if you don't get it right and then you discover along the way you've been doing it wrong, the cost is higher in terms of money and time, and even the patient's well-being.
I've been involved in other research institutions, but I realized that the tools that you've developed is to get evidence-based practice, like the PACES and then the GRIPS, they are not very common, but they are very simple tools that we will need for basic research.
Well, I like the simplicity. I really like this simplicity. Trying to get all this complex information and put it in a very, very basic, simple way. I think that's the age that JBI brings in. That
we're talking about the JBI. It's that one, it's simple, it's summarized to be effective for you to use it either at the point of care or even later in the day when you want to read about a certain issue. But also that it's evidence informed. It's not just another textbook on an issue. It's basically a review of many such cases and coming up with what has worked best in certain, contexts. I mean, all this knowledge that I acquire helps me to learn and also see how we can change things in Kenya, because I think for a long time we've not had proper systems and proper strategies to improve healthcare, which is actually a human right. So there's just practicing what you know, and there's practicing what has been informed by evidence. And it makes it much more interesting to know that you're actually doing what is right and has evidence backing, every decision that you make. People think it's costly to practice good medicine, but it's more costly when you do it wrong and have to repeat it a second time to get it right.
So I one time joked with one of my colleagues and said, for us in Uganda, people live at the graveyards. But here it is so difficult to die because somebody will rescue you, including an airlifting. So, so we look at this and it touches me with a lot of passion. I really say, but can't we get towards this? So the learning is beyond the class. It's even by looking, by interaction, by listening. We learn in many ways.
Everybody is like, the moment we get back, we are going to continue this, and that. Like my colleague from Ethiopia, it was amazing because yesterday we were talking about waste disposal. It was bad news, but she has done a lot and she hopes to do much more. Even colleagues from Kenya, colleagues from Ghana, it's really amazing.
We are the first African clinical fellows. Yes, so I think to me, I'm very proud to be part of it, because our names are going to be written in history of the institution, and that's what I'm taking home.
You're going to become the Minister for Health?
Yeah, definitely. In 2017, I'll make sure I do an email and tell you I'm on the seat. Yeah.